Before you go to bed tonight, there's something you need to know because one of the most common AFib triggers may have nothing to do with what you eat, how stressed you are, or which medications you're taking. It may be your sleeping position. In fact, researchers have identified one position that keeps showing up again and again in AFib patients whose symptoms get worse at night. The scary part, most people have no idea they're doing it. Today, I'll show you what the research found, why it happens, and the simple adjustment that could help you wake up with fewer symptoms. And if you're one of the millions of people living with AFib, make sure you're subscribed. Every week, we break down the latest research and practical strategies to help you take control of your heart rhythm. Let's get into the video. First, let's talk about what's actually happening in your body when AFib fires at night. Most people assume that AFib is random, like a lightning strike. It just happens when it happens, but that's not entirely true. AFib needs a trigger, and it needs a substrate, meaning the right conditions have to exist for it to ignite. One of the most underappreciated triggers is something called stretch. Your heart's upper chambers, the atria, are sensitive to being stretched, and the pulmonary veins, which are the small vessels that carry oxygenated blood from your lungs into your heart, are particularly sensitive. In fact, the pulmonary veins are considered the most common source of the rogue electrical signals that kick off an AFib episode. Here's where sleeping position comes in. When you lie on your left side, what doctors call the left lateral decubitus position, your heart literally shifts inside your chest, and it moves forward and to the left. Because your heart is suspended by those large blood vessels, when it shifts, it pulls on the pulmonary veins. It stretches them. And research published in Frontiers in Physiology confirmed this directly. When study participants moved from lying on their back to lying on their left side, the diameter of the right superior pulmonary vein increased by 19%. The volume of the left atrium expanded by 17%. And that's not a small change. That's your heart's most arrhythmia-prone tissue being physically stretched every single time you roll onto your left side. And stretched tissue does something dangerous in the context of AFib. It activates what are called stretch-sensitive ion channels. These channels generate electrical signals when the tissue is under mechanical stress. These signals create chaotic, disorganized electrical activity, which is exactly what AFib is. So when you sleep on your left side, you actually may be mechanically loading the very structures most likely to trigger your AFib. Now let's look at the numbers, because I want you to see how real this is. Researchers studied 94 patients with paroxysmal AFib. That's the kind that comes and goes. They asked each patient whether a specific body position seemed to trigger their symptoms. 22% of those patients said yes. Nearly 1 in 4 people with AFib reported that a specific sleeping position was a clear trigger for their episodes. And when they broke down which position was the culprit, the results were actually quite striking. Of the patients who had positional triggers, 57% said it was, you guessed it, on their left side. 33% said that it was lying on their back, and 10% said on their right side, and just 5% face down. That's a statistically significant result. The left side was by far the most common trigger. The researchers also noticed something else. The patients who had positional AFib triggers tended to have a higher BMI, a higher body weight than those who didn't. That matters because extra weight changes the mechanics of your chest and puts more pressure on your heart's position inside the thorax. A comprehensive 2024 review in JACC Clinical Electrophysiology confirmed these findings, noting that approximately 22% of AFib patients report position-dependent symptom onset, with the left lateral position being the most frequently implicated. Now, I want to be completely straight with you here. The science on this is real, but it's still evolving. There has been no large randomized controlled trial that has yet proven that simply avoiding the left side will reduce your AFib episodes. What we have is a strong mechanistic evidence and consistent observational data pointing in the same direction. This is an area where the science is building and the practical implications are already meaningful enough to act on. All right, here's the practical part. Here's what you can actually do starting tonight. Step 1. Figure out if you have positional AFib. Not everyone does. Remember, Only about 22% of AFib patients in the research reported any positional triggers. So, the first step is honest self-observation. Think back to your last several AFib episodes. Did they start at night or while you were lying down? Did you notice you were on your left side when symptoms began? If the answer is yes, even a soft yes, that's worth paying attention to. Step 2. Start sleeping on your right side. This is the simplest and most immediate change you can make. The right lateral position keeps your heart in a more neutral position inside your chest. It doesn't create the same mechanical stretch on the pulmonary veins. It doesn't worsen sleep apnea the way face-up or supine position does. For most AFib patients, the right side is the safest default. Now, if you're a natural left-side sleeper, this is going to feel awkward at first, and that's normal. Your body has a preferred position, and it will try to roll back to it during night, which brings us to Step 3. Step 3, use physical barriers to stay on your right side. The simplest approach, and this comes directly from the sleep apnea literature where it's been studied, is to put a firm object on your left side, which makes it uncomfortable to roll over. The classic version of this is called the tennis ball technique. You sew or clip a tennis ball to the left side of your pajama top. I know, sounds funny, but again, that's the sleep apnea research. When you roll onto your left side in your sleep, that discomfort wakes you enough just to shift back. It sounds almost too simple, but it actually does work. Studies on positional sleep apnea, where patients need to avoid sleeping on their back, show that this technique actually meaningfully reduces time spent in the unwanted position. A more comfortable modern version is a full-length body pillow placed alongside your left side. You essentially build a soft wall that discourages rolling. Many people find this more comfortable than the tennis ball approach described in the older literature, and it has the added benefit of giving you something to lean into, which can actually improve sleep quality. Step 4. Consider vibratory tactile positional therapy device. That's a thing. This is the more high-tech option for you techies out there, and the research behind it is genuinely impressive. These are small, wearable devices, worn usually on the neck or the chest, with an inbuilt-in accelerometer that detect your body position at sleep. When you roll into the position you're trying to avoid, a device delivers a little gentle vibration, not enough to fully wake you, but just enough to prompt you to shift your body back. And quite effective. A systematic review and meta-analysis of 18 studies found that these devices reduce time spent in that target position by approximately 70%, and critically, they did this without significantly disrupting sleep quality. These devices were designed for sleep apnea patients who need to avoid the supine position. But the same technology can be adapted to discourage left-sided sleeping. So, stay tuned, because I have so much more to discuss with you about sleep apnea. Now, let me address the questions I know some of you are already asking. What if I try this and it doesn't work for me? And that's a completely valid concern. Remember, only about 22% of AFib patients have clear positional triggers. If you genuinely don't notice a pattern between your sleeping position and your episodes, then positional therapy may not be your highest leverage intervention, and that's okay. The steps around sleep apnea, sleep duration, and weight management still apply to virtually everyone with AFib. The goal here is not to give you a magic fix. The goal is to systematically remove every single modifiable risk factor that we can identify that could be feeding your AFib. Sleeping position is one piece of that puzzle, and sleep apnea is another. Sleep quality is another. Weight is another. Each one you address stacks on top of the others. Is it safe to just change my sleeping position on my own without telling my doctor? Yes, adjusting your sleeping position is often completely safe to do on your own. It is not a medical intervention. It carries no risk. The only caution I would give you is this: if you suspect you have sleep apnea, don't try to manage it with positional changes alone. Get a proper evaluation. Sleep apnea needs to be diagnosed and treated appropriately. And that leads me, here's the challenge I want to leave you with. Tonight, just tonight, try sleeping on your right side. Put a pillow on your left side. See how you feel in the morning. Track it. Do it for 2 weeks and pay attention to whether your nighttime symptoms change. That's all I'm asking. 2 weeks, one simple change. Now, here's the surprising part. For many AFib patients, sleeping position isn't actually the biggest nighttime trigger. The bigger problem may be what happens after you fall asleep. So, in the next video, I'm going to show you the 5 signs sleep apnea may be quietly making your AFib worse and why treating it can have a huge positive impact on your AFib. They could drop recurrence by as much as 40 to 60%. And if you want to go deeper on this, if you want a complete structured action plan for managing your AFib through lifestyle, sleep, and evidence-based strategies, then go to www.stopafib.com. There, you can download a free AFib action plan. It's built specifically for patients who are done just managing symptoms and who are ready to take real, meaningful steps towards restoring their rhythm and reclaiming their life. It covers sleep, diet, exercise, stress, and the conversations you need to be having with your care team.